Hello guys, we have this topic today which is peripheral nerve. So what is the peripheral nerve for? Let's see that. So peripheral nerve basically stays outside the brain. The next thing which they do is that they transfer information between brain to rest of the body. And now it is divided into two parts. What are they? ANS and SNS. Autonomic nervous system and somatic nervous system. Now, what is the function of ANS, autonomic nervous system, is to control the involuntary body function. Now, whereas what is the function of somatic nerve is to control muscle movements and transferring information from ears, eyes, and to this what nervous system to the central nervous. Now, let's look at this diagram. As we can see, we have this nerve trunk. Then we have apinium, which is outer layer. Then we have this perineum, middle layer, covering or andonium. Endo means inside. All right. And here we're going to have some space. Here we're going to have these. You are seeing it's basically adipose tissues. So what adipose tissues are doing here? They are providing support and protection to this nerve tissues. Also, it's working as an insulin to this whole thing. It's basically doing a lot. It's also, working as an storage for energy, maintaining nerve function during times of increased metabolic demand. Yeah, it's playing a great role here. Now let's look what they are saying about these layers. So let's start with the apinium, which is a first layer. So what apinium is doing basically, it's a dense connective tissue that surrounds the entire nerve. So we can see here, this is an entire nerve, and you can see that this apinium. So apinium is covering all the fascia and blood vessels. And what this outermost layer is doing basically, it's providing the support, resistance to all the mechanical stress that happens in case of injury, maintaining the integrity and function of the. Now let's see perineum. We can see the perineum layer is covering the nerve fibers. So it's going to provide a mechanical or protective support to the nerve fibers, axon. So also what they're saying that it's a blood nerve permeability barrier. So it's going to be a barrier. It's not going to provide a barrier which is going to separate the bloodstream from the peripheral nervous system. So here it's going to like separate the blood and other stuff from going into it. It's not going to allow the molecules to pass through. It's going to work as a barrier between the blood and the nerve. All right. And as they're saying, it's going to surround the fascicles of the nerve fibers. So here we have the nerve fibers, and we have here going to be the fascicles, and it's surrounding the fascicles. All right. So here we can remember it by P and P. P perineum, P for perineum, and P for permeability also. So here we can make sure that the perineum is the main thing is going to be the BNB thing. All right. And the apinium, we know it's going to be the outermost and it's going to cover everything entire nerve. Now let's see andonium. In andonium, it's thin, it's a very thin layer, and it's going to support, it's going to be supportive connect, and it's going to ensure and support individual myelinated fibers. So it's going to, it's here, and you can see it's supporting and providing a shelf to this nerve fiber, which is going to be myelinated. And this nerve fibers is all myelinated, so axons are myelinated. So basically, they're talking about the axons only. And in the thing, so it's going to be affected in GBS, which is Guillain-Barré syndrome. One more thing we need to add on at what this GBS syndrome is. It's actually an immune system where the immune system, it's an immune system thing where the immune system attacks the nerve, their own nerves, due to a bacterial infection, or it can be a viral infection also. So in this condition, GBS is going to affect the muscles badly, losing the mobility. So here, what it is now, they're saying that Indo is inner, that peri, around, api means outer. Now let's look into this neural response injury, how neurons are going to respond in case of the axonal injury, if there is any injury happening to the axon. So in this injury, they're going to be this process, or you can see this reaction which occurs that is called chromatolysis, where we can see that there's a dispersion of nasal substance happens. So there is a spread of nasal substance happens, and what are the nasal substance? They are the nasal granules. Basically, they're talking about the ribosomes, rough endoplasmic. Yeah. So the spread happens of the ribosomes here throughout the cytoplasm, which is often not visible on screen, and that is a different story why it is not visible. But here we see that the neural cell body reaction reflecting high. So it happens because chromatolysis happens because when any injury happening to the axon, what happens is there is a there's an increased demand for protein synthesis. All right. And in order to generate the axon, in order to regenerate the axon, so for that it happens, and the ribosomes so that's what the substance are all about, and this is what they're saying, that the neural cell body reaction reflecting is going to get reflecting into the high protein synthesis in effort to repair the damaged axon. That's what, which is often going to accompany, and which is going to, get into the inflammation thing also, and going to give you that round cellular swelling. They're going to be swelling around, and they're going to be a displacement nucleus to periphery position. All right. So there's, if you know what is the periphery position, when the nucleus got shifted, get displaced or shifted to the, the outer side of the cell. So that is a periphery situation. That is going to happen, the displacement of nucleus to that periphery side. Also, what we are going to see, we are going to see a round cellular swelling. So let's mark, they're going to be, if chromatolysis happening, is going to spread out, and because of the high protein, because of that high protein synthesis is going to happen, they're going to be a cellular swelling, and they're going to be a displacement of nucleus to periphery. As we can see all these things happening here also. If you see here, we can see the cellular has swelling happening. You can see it's getting that round swelling, the displacement of nucleus happening. You can see it should be here, and it's going to the periphery side. And here we can see that spread dispersion of nasal substance. You can see the substance here, and all this happening in the soma. Okay, so now let's see axonal retraction. In axonal retraction, as we can see, it's happening here. There's a part of it being cut out, and the new protrusion is growing from that. So this is what they're saying exactly. The axon retraction is the proximal axon segment retracts. So the proximal, the starting one, the proximal axon segment is going to retract, as you can see the small one, and sprouts new. retraction. So you can see that the new one is growing out of it, that grow towards other neurons for potential reinversion. Okay, for the new supply to the nerve. Okay, so that's what they're talking about, that the this is what happening. But this axonal retraction happening because of the injury, but it also happens when the baby is being developed, and in during the embryological development also this happens. This is how the axons basically gets divided, and gets retract themselves in order to just stop. And there's an advantage in PNS, the peripheral nervous system, which we can see that the Schwann cells create a track that guide axonal regeneration. So they're going to be a track. You can see the Schwann cells. So they're going to guide the track where it needs to be regenerated. Now we have Wallerian degeneration. So you can see this is happening here, the Wallerian degeneration. So the distal part here, you can see the part which is like distal part is the one which is away from the center of the neuron. So you can see it's the like kind of ending part. So the distal axon segment and associated myelin shells, you can see this yellow myelin shell is going to disintegrate and going to get into the smaller pieces with microphages removing the debris. So you can see that the micro so you can see the myelin debris here, which they're talking about, and the disintegration is also happening. You can see the small parts, and this now microglia cells are infiltrating it, and helping in removing the debris. So now in the CNS, what happens is there be a persistence of myelin debris. So and reactive gliolysis prevent axonal regeneration. So what is they are trying to say here is that this myelin debris is actually going to act as a physical barrier for the axonal regeneration. Like it's going to act as a barrier and making difficult for the axon to regenerate. So for that, these glial cells deactivate, and that is what they're talking about, the reactive glial. Gliosis is basically is the form of glial cells. So the glial cell is going to help it out and support the natural process of axonal regeneration by inhibiting the molecules which are and this debris is making it difficult, so they're going to make the process easier through activating the gliosis, and make the process quite natural for the axonal region. Okay, now we have seen what were the glial cells. So the glial cells we had was astrocytes, which was like a star. The shape, the appearance was like a star. And we also studied when these astrocytes actually gets activated during the time of injury or trauma, infection, or neurodegenerative diseases, which we saw. So this is how we see an environment of neural repair. This is how it acts on a neuron. So yeah.